Hi there, mom and dad. Is your child sick and has been prescribed with antibiotics? Or your child has a viral infection and you're wondering, why isn't my kid given an antibiotic? Or you're wondering about antibiotic resistance? Well, you're in luck. In today's Ask Me Anything episode, I will answer your top 10 most common questions on antibiotic use in kids. Before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you moms and dads so you can raise happy and healthy kids. Now let's get started. The first question: when are antibiotics necessary for my child? Antibiotics are needed if your child has a bacterial infection, for example, a strep throat or a tonsillitis due to a bacteria known as streptococcus. Certain types of pneumonia that are bacterial in nature would also need antibiotics. Also, urinary tract infections would need antibiotics, and some ear infections due to bacteria. Antibiotics are not effective for viral infections such as the common cold or the flu or most cases of bronchitis that are just due to viral infection. Number 2, how can I tell if my child's illness is bacterial or viral? It is often difficult to distinguish if the infection is due to bacteria or if it is due to a virus. But your doctor would be able to delineate that. So your doctor would need to ask about your child's medical history, do a complete physical examination, and it is sometimes necessary for your doctor to do certain tests to verify the cause of your child's illness. That, therefore, we can classify the infection as bacterial or viral. Number 3, what are the risks of unnecessary antibiotic use? This is a good question. The risk of unnecessary antibiotic use can lead to antibiotic resistance. What does it mean? It means that in your child's future infection, it is going to be harder to treat with antibiotics. Also, unnecessary antibiotic use can lead to side effects such as allergic reactions. It can also cause some gastrointestinal discomfort like diarrhea or nausea and vomiting. And unnecessary antibiotic use can also lead to yeast infection or fungal infection. Number 4, how should I administer antibiotics to my child? Well, it is best that you follow the prescription and follow the doctor's instruction. Use the correct dose and the correct timing and complete the entire course of antibiotics. If the antibiotics has been prescribed for a week, complete it for 7 days. Even if your child is feeling better, you should not stop the treatment until you have completed the full course. Skipping doses and also stopping early can lead to the infection returning and can contribute to antibiotic resistance. All right, number 5. Good question. What should I do if my child misses a dose? So, if you miss the dose, well, you give the dose as soon as you remember it. But if the missed dose is going to be too close to the next dose, it is better you skip that dose and give the regular dosing schedule. You should not give 2 doses right about the same time. So it is better just to skip the dose. Number 6, can antibiotics cause side effects? Yes, antibiotics can cause side effects. Most commonly are gastrointestinal discomfort. So diarrhea, nausea, vomiting are common side effects of antibiotics. Antibiotics can also lead to a rash or yeast or fungal infection. And in rare cases, antibiotics can lead to allergic reaction. Number 7. Are there alternatives for antibiotics? Well, if your child has a viral infection, the treatment is supportive care. So, with lots of rest, plenty of fluids, and over the counter medications for whatever your child's symptoms are. So, if your child has a fever, you can buy over the counter fever reducing medications such as acetaminophen or paracetamol or ibuprofen. Like if your child has a cough, you can give over-the-counter mucolytics. Um, Another alternative, well, are vaccinations because vaccinations can prevent some bacterial infections that would reduce the need for antibiotics. All right, number 8. How can I help prevent antibiotic resistance? Well, to prevent antibiotic resistance, only use the antibiotics that has been prescribed by your doctor. Follow the full course of the antibiotics and follow the correct dosing schedule. Avoid using leftover antibiotics from previous infections and also avoid pressuring your doctor to give your child antibiotics when the doctor doesn't think your child needs them. Number 9. Can my child develop an allergy to antibiotics? Well, allergies to antibiotics, particularly penicillins, can occur. These can sometimes lead to a rash, hives, or anaphylaxis or a severe allergic reaction. If your child is showing some of these signs, well, contact your doctor immediately or bring to the ER. Number 10. What should I discuss with my pediatrician before my child takes antibiotics? It is best that you discuss your child's medical history with the doctor first. Then the doctor would need to do a complete examination. You should also discuss with your doctor if your child has known allergies, the specific infection that is being treated, and how about you ask about the expected side effects from your child's antibiotics. Clarify any doubts or questions you have about the dosing schedule and the dosing course. Hey, if you like this episode, watch my next video where I teach you about other child health problems.